a new study from High Rise Financial found Connecticut has some of the longest ER wait times in the country, sitting at number 8. The average wait time from arrival until a patient leaves is 186 minutes, and that's a little over 3 hours.
Now, researchers noted states with shorter wait times illustrated a more efficient and effective emergency care process. Paul Kidwell is Senior Vice President at Connecticut Hospital Association. He joins us now to discuss what could be behind the number. Paul, we appreciate your time. And let me ask you first, what do you think about that number? Does it surprise you? 186 minutes.
Yeah, we know certainly it can be extremely frustrating, right? When an individual comes to the emergency department in a time of great need, and any amount of time waiting is extremely frustrating. So I know at hospitals across the state, clinical professionals are doing everything they can to make sure that individuals are seen timely and get the care they need.
Well, the study noted that a longer wait time would indicate a less effective emergency care process. Do you think that's a fair thing to say, that are Connecticut's ERs less effective or less efficient?
Yeah, I think we need to look at some of the other circumstances related to some of those wait times, and we can look at, I think, a couple factors. One is many of our emergency departments are caring for patients with acute mental health needs, and we think some resources should be certainly brought to bear to making sure that those behavioral health needs are treated in the community outside of the emergency department. So we don't see so many patients in that acute need coming to the emergency department. I think another really important aspect of this is what is happening when upstairs, as you may say, up in an inpatient room. So when patients no longer need to be in the hospital, we need to make sure they get discharged safely. And that means prior authorization from insurance companies, and that we can find an available bed at a skilled nursing facility or provide home care. So there are many factors that we need to look into, or we need to work in as a state to make sure that we start to bring down some of those ER wait times.
Paul, it seems like staffing has hit just about every industry out there, and hospitals are no different. You think that factors in here? And how could Connecticut hospitals attract more staff?
Absolutely. We have an acute need for more healthcare workers in hospitals, both clinically and non-clinically. And we're doing a number of things to make sure we're attracting new workers. One, making sure that our salaries are appropriate for the role, making sure we provide bonuses, making sure that the environment in which individuals work are safe. We're also working with schools and universities across the state to really open up the pipeline of healthcare employees, and reaching down into high schools to make sure that even high school kids are aware of the opportunities in the field.
All right. Well, thank you, Paul Kidwell. And as an aside, too, we don't want to discourage anyone from seeking emergency care. I feel like that's really important to note, that they're just trying, hospital staff are trying their hardest.
Absolutely. Folks should get emergency care when they need it. Absolutely. Thanks for mentioning that.
Thank you for joining us, Paul.
Thank you.